Good evening, and welcome to the Ombudsman program. My name is Diane Welborn, and I am the Ombudsman, and I'm going to be your host for this evening's program. I am delighted tonight to bring to our viewers the topic of the Long-Term Care Ombudsman program. This program is an important part of the Ombudsman's office, and I'm very pleased tonight to be bringing to introduce to you our Long-Term Care Program Director, Lawrence Chip Wilkins. Thank you so much for coming on the program tonight.
My pleasure.
That's great. So Chip has been with us since the end of the summer, and we're just very pleased that he's here, and we wanted to take this opportunity to tell everyone what our long-term ombudsman program does for residents in our area. So we'll just go ahead and get started, Chip, if that's okay with you. The long-term care ombudsman program has been around for some time, but I'm not sure that people know very much about its origins. If you would like to, why don't you tell us how it came to be?
Sure. You know, interestingly enough, this was the 50-year anniversary of the of the Older Americans Act, which spawned or created the Ombudsman program. Back in 1965, the Older Americans Act was signed into law by President Lyndon Johnson, who realized, along with Congress at the time, that the older generation of the time was becoming much more diverse and required special protection under the law. So they formulated an act, called it the Older Americans Act, and from that it has grown and grown. And finally, in 1972, it was determined that long-term care ombudsmen were required to be placed in every state. And long-term care came out of that Older Americans Act in order to safeguard and protect the older Americans who were in nursing homes, in assisted living facilities.
Yeah, exactly. And there are other components of that act that also serve seniors in addition to the Ombudsman program. Would you like to just touch on a few of those?
Sure. Out of the Older Americans Act, they have many parts to it, like any act, and they don't call them parts. That would be too easy. They have to call them titles. Right. So each different section is called a title. And I know, for instance, in Title III and Title VII, there are a lot of programs that support the elderly, the poor, the disenfranchised. For instance, a great example is the Meals on Wheels program, which comes directly from the Older Americans Act to provide food to individuals who otherwise couldn't get out to shop for food, couldn't afford to do that. That's just one example of a whole host of different programs that are covered under the Older Americans Act.
Right, and along with that are the meal centers where people can come and have socialization as well as a low-cost meal, and then also things like legal services to help seniors. So that act actually encompasses a lot more than what we do with it in the Ombudsman program, but I think it's good for people to know how important that act is and its continuation is in serving seniors really all over the nation.
Absolutely.
But particularly right here where we live,
right.
and our seniors. So tell us a bit about the fact that there are long-term care ombudsmen in each of the 50 states. What does that look like?
Well, it's interesting. The Congress, in their wisdom, determined that we as a nation needed to protect the integrity of individuals as they age. So they said, excuse me, that we are going to place ombudsmen in each state, and we are going to make one ombudsman, the long-term care ombudsman, who will represent the entire state. If states didn't do that, they would not receive certain Medicare funding. So, of course, every state did it and created an ombudsman program. In Ohio, for instance, we have a long-term care ombudsman. Her name is Bev Laubert. Mm-hmm. Underneath her are hundreds of other ombudsmen. The way Ohio is set up, we are separated into 12 regions. Particularly here in the Dayton area, we're considered Region 2. But we all fall under the long-term care ombudsman for the state.
Right, and I want you to hold that thought because we have a caller.
Oh.
So we will come back to that. So I'd like to invite our caller to make your comment or give us a question, please. You're on the air.
I'm Linda Stickway, and I'm a long-term care volunteer.
Wonderful.
7 years. And I want to share with you how really important volunteering is for many of the people. Actually, a majority of the people in many of our homes have no one to advocate for them, no one to stand up for them, no one to make a difference in their lives. They're often afraid to complain because they're afraid of repercussions. But we're a safe outlet, and we can make remarkable changes. We have a home that was not providing evening snacks for the residents and getting involved, making sure they understood the Ohio law, and we were able to get that changed. So now a snack cart goes to each room around 8 o'clock in the evening, making sure that residents have a right to have something to eat in the evenings. So
Thank you. Thank you for bringing that up. Please go ahead.
Or it was a resident who was too large for the wheelchair he had, and he wanted a new wheelchair, but the Medicare law had been at one time that items like that were purchased under the resident's name. But when the law changed, the nursing homes each got an amount each month for the residents at large, and then they could use that for any individual resident. The home had said that they did not have the money for them, but when I reminded them of the changes that had been made, they were able to find that money and get this resident a chair that was comfortable and safe for him.
That's a wonderful example of good advocacy. Thank you. Do you have others?
You are welcome. Well, it's just, and sometimes it's just as small as holding a hand and listening, because so many people have no one to listen to, no one to talk to, no one to touch them,
right?
Hand on a shoulder and make them feel special. So it's not just problem solving; it's caring on a regular basis and being there weekly, so they know it's someone that they can count on.
Well, we thank you very much for your effort on behalf of residents, and we thank you for calling into the program this evening.
My pleasure.
Thank you.
Bye-bye.
Bye-bye. I'm being told that we have another call, and so I'm going to get them on the air in a second. I just wanted to highlight one of the things that our volunteer pointed out is that most people who live in our long-term care facilities do not have anybody that's visiting them on a regular basis. So it can be a lonely and very vulnerable experience.
I will tell you, we know from experience, and we have shared this in the office, that 60% of all of the seniors that are in nursing homes have no family and no one that visits or comes and provides any kind of companionship.
Right.
Volunteers make a huge difference. It's amazing that people like the volunteer who just called, someone is excited because they know that she is coming on a certain day.
Right.
And it gives them something to look forward to.
And they know she can get things done.
Amen.
All right, so we have another caller that would like to join the program. Thank you. You're on the air.
Yes, I am a volunteer with the Long-Term Care Ombudsman Program.
Thank you.
I visit nursing homes, and I have the honor and privilege of listening to residents, hearing their concerns, seeing if there's a way that myself or our office can assist them with issues. The best thing for me involving advocacy is that I am able to listen to them, respecting them, and learning about what life is like where they are. Many of them are happy and like being where they are, and I see excellent care given. Some of them have very small questions, and I'm happy to be able to help.
Well, we're very happy you're there to help them. Thank you very much.
It's an excellent program. I would invite anyone who has an interest, a desire, some time to give back and to volunteer in the community.
Thank you so much for your comments. We appreciate your calling in.
All right. Good night.
Good night. Bye. So we were telling people a bit about the Older Americans Act, but thanks to those volunteers calling in, let's swing it back now. They're in the facilities. They're there on a regular basis so that residents can get to know them, and they are there to help advocate for residents' rights. So why don't you tell us a little bit about the residents' rights that these volunteers are advocating for?
Resident rights, Diane, are the backbone of what we do as long-term care ombudsman. The Ohio law has the Constitution, and we all know, we've all heard of our Bill of Rights that we have grown up learning about in social studies and civics. Well, there is an additional set of rights equal to the Bill of Rights. It's called residence rights, and it's in the Ohio law. It's section 3721.13, and it lists all of these rights that residents have when they are in a long-term care facility. They have 27 enumerated rights that are within the law. They have the right to participate in their care and treatment. They have the right to have warm meals. They have the right to a clean room. It is a set of rights that uphold the dignity and respect that we should hope our older Americans have. And it is the resident rights that we as ombudsmen are trying many times to enforce. We say that there is no complaint that comes into the office that's ever too small, because almost every complaint can be plugged into one of those resident rights. And it is what we do, because something as small as a meal being served warm will greatly impact someone's life. And each person's life is valuable. And I think that's a lot of what ombudsman work is about. And what volunteers do is help us enforce those rights and to make sure that everyone in the home knows that they have these rights. That's one of the biggest challenges that we face, is that so many people go into nursing homes or assisted living facilities. And to give you an example, in our region, we cover 9 counties. Montgomery County is one of those, and we have 14,852 beds within our region. So that's 14,000 individuals that we are trying to make certain that they are being taken care of correctly, that their rights are being upheld under the resident rights, and that they know that there are people that genuinely care about them.
Right. And I think it's probably also fair to say that all of these rights taken together are moving toward viewing the care that the person receives as being person-centered, and that while individuals may live in a long-term care facility, it is nonetheless their home, and that's why they retain so many of these rights, is because it is their home. So, you've talked about the counties, you've talked about the total residents that we have. Let's talk talk about how care has changed since the Older Americans Act was signed and how care is now delivered to seniors and frail elderly in our community?
Sure. You know, the idea that nursing homes are person-centered, as you stated, is a relatively new concept. It used to be that the care that was provided was very institutional, sterile. There was very little concern about a person's wishes and desires. There wasn't this idea that their facility, their nursing home, their assisted living arrangement is their home. Well, when the Older Americans Act came into play, the individual was to be put first. And as time has gone on since 1965, many individuals and groups have championed this idea of person-centered care. Now when an individual comes into a facility, it's not a sterile environment where one type of treatment fits everyone. An individual is carefully questioned about their likes, their dislikes. What time do they typically get up in the morning? What time do they go to bed? What type of, or when do they like to bathe? Do they like a shower? Do they like a bath? All of these issues that were ignored for century or decade after decade are now at the heart and soul of what person-centered care is all about. And none of this would have come about had it not been for the Older Americans Act and the work of Ombudsman. Now, whenever someone goes into a skilled nursing facility or an assisted living facility, they are questioned as to what are their preferences, because we as a society want to try and meet those basic needs of enabling someone to sleep in and giving them the ability to shower in the evening as opposed to the morning, because the individual is what is most important now. And I think that's the biggest change that has occurred because of the Older Americans Act.
Right. I think also that that many individuals do not plan to go and to live in a nursing home, but often it comes about due to some kind of accident or health problem that they encounter that is not planned for. And so why don't you talk with our viewers a bit about the help that our office can provide when individuals and families find themselves having to make a selection about where are they going to go?
Sure. You know, we, first and foremost, as long-term care ombudsman, we don't champion one facility over another. That's not our role, and we don't do that. However, if someone calls our office and wants to know how a certain facility has been evaluated by the state of Ohio, we can tell them that. If they want to know if there have been complaints against a certain facility, they can call us, and we have that information at our fingertips. It's interesting that now through the Ohio Department of Health, there is a careful screening and constant review of nursing homes, and they keep information in the computer and available for anyone to look up. Some of this includes resident surveys. Every other year they send a survey to the residents of nursing homes, and they say, hey, rate the facility on a scale of 1 to 10, and they do it in a variety of categories. They will also, every other year, ask the family members of the resident what they think of the facility. And these survey results are available, and they are online, but they are also at our fingertips. So when people call in, we can tell them what the satisfaction survey results are. And that, along with the body of complaints that we may have taken in for a facility, can really help someone make an informed decision about a facility, particularly if their loved one has a need that needs to be addressed and might very well come up in a complaint or a survey about a specific area. Maybe it's dementia or Alzheimer's or rehab. We have that information.
Okay. And also, talk to the viewers a bit about what are the most important considerations in doing this selection of a nursing home.
Sure. I will tell you that there are many things to consider when choosing a nursing home. You certainly want a facility that has a high satisfaction rate by both the residents and the family. You would like to see a facility with a relatively low number of complaints, particularly complaints in the same area. If you find a facility that is continually having response time complaints to call lights, and they haven't learned from their mistake, that's something you want to know.
Yes, and we have another caller, so
Great.
we'll come back to that. But thank you for calling into the program. We'd like to hear from you. You're on the air.
Yes, thank you. Thank you for this good program. I'm so impressed with the new director of the long-term care program, his grasp of the concept of the law, of the humanity of the people being served. It's great that you have a lawyer in that position now. My question actually relates to the law. Some years ago, my aunt was in a facility, and someone unrelated to the facility, someone from the outside with whom my aunt had carried on a correspondence, began to prey upon her financially, insinuated herself into my aunt's confidence, and some time passed before I discovered what was happening. And I learned of it only through a comment made by a sister. But $10,000 a month was being taken from my aunt. This was in another state. It was not in Ohio, and there was no ombudsman. So I had to resort to the city attorney, who fortunately was an old high school classmate, in order to put a stop to this. But in a situation like that, which might happen here in the state of Ohio, what are the signs or the symptoms of this kind of abuse of the elderly by someone from the outside of a facility? And what sort of steps can the ombudsman take? How would family members approach the ombudsman in cases like this?
Thank you. That's a very excellent question, and we will get an answer for you right away. This caller's comment goes directly to the exploitation of the elderly, whether they're in a facility or whether they're in the community. And that is something that our office is extremely concerned about, and we feel like we're seeing more of that happening. So there are many ways in which we can respond to this, and I'll let you get started on that.
All right. Well, I will tell you, thank you, caller, for the kind comments. I do have a legal background in training, but I tell everyone now that I am a retired lawyer and a full-time ombudsman because I am passionate about the work that we do. And financial exploitation is something that we see far too often, and it is just a horrible crime conduct on the part of individuals that 90% of the time it's from someone in the family or close to the individual. And the symptoms of that are sometimes very difficult to see, because a lot of times when you have an individual in a nursing home or an assisted living facility, they go there with a power of attorney being established. Someone is helping them with their finances, someone they presumably trust, but many times that trust is betrayed, and the individual that is serving as the power of attorney is using funds from this loved one or from the resident of the nursing home for their own personal gain, maybe to pay a mortgage payment here or there, to buy a present for someone. Those are very difficult transactions to really see in any real sense. It's when they start to lose homes, when they start to have bill collectors calling for things that never were a problem before. Those are the first symptoms that the family can really be aware of. If grandma or grandpa never had problems with bill collectors and then suddenly do, and it's out of character for them financially, that should be the first alert to a family member.
Right. I think also that being in close touch with the loved one to see if there are any signs that you've already described is so very important, because many of our seniors may be embarrassed by being taken by a stranger and are understandably hurt by being defrauded by someone that they love. So that kind of makes it hard for it to be discussed. But we, as ombudsmen, we're not police, but once we do learn about a situation like this, we know how to investigate it and where to go with it. As I said, we have increasingly had higher numbers of cases with this. Is there one or two that you would like to highlight about how it all came out?
Sure. The first one that jumps to mind is we had a volunteer that was at a facility and was approached by a resident who asked if he could happen to look at her bank statements or his bank statements. And this individual was concerned that money was not there that should be there. And the volunteer did look at the bank statements, conducted an investigation along with one of the staff ombudsmen, and because that resident was brave enough to ask this volunteer, ultimately we were able to conclude that about $40,000 of this individual's money had been spent by someone with a fiduciary duty, like a power of attorney, and it was done without the resident's consent. And ultimately, we were able to make certain that no additional funds were taken, and at least let the resident decide criminally whether they were going to pursue charges or not.
Right, right. And I think we should also remark that sometimes it is staff in facilities that have a suspicion that something may be happening and may encourage the resident to call our office so we can come and talk with them about it, or they may call and we go out and visit. But that whole area of financial exploitation is something that we unfortunately are too well aware of, and we encourage individuals to report this because that's the only way to get anything done about that. I'd like to turn back a little bit to how our need for volunteers, the value of the volunteers, such as people who have contacted us earlier. Let's talk a little bit about what our volunteers do in our program and how they apply and how they're trained.
Well, I will tell you that we are first and foremost a volunteer-driven organization. There are simply too many facilities and too many individuals for our staff to monitor on a regular basis. Because of that, and we have in our region over 142 homes now that we cover, we need volunteers, and we can't do our work without volunteers. But a volunteer that comes into the Ombudsman program, most of them have never heard of the term Ombudsman before they are connected with our office. And we don't send anyone out cold without any preparation or training. In fact, each volunteer ombudsman goes through a 12-hour training session, after which they are at the early stages of their being a certified volunteer ombudsman. But then after that, we go out into the homes with the volunteers. Ideally, we like for one volunteer to take a home or maybe two as their own, and they become a regular presence in that home. They visit it every 2 to 4 weeks. They go to meals there. They make rounds. They get to build relationships with incredible people. And they are there doing work as ombudsman, which many times, as our first caller said, is being a sounding board or having someone there to have contact with. But sometimes it's to address an issue. And when it is, the ombudsman that's volunteering there has been trained how to handle that. Now, I will tell you, it is regimented at first. I mean, the first 8 visits that a volunteer makes to the home, there is a formula, if you will,
A guide,
yeah. that they are to follow, and over time that guide is tweaked and honed to their personality, and they become a regular presence in a home. One of the callers earlier, I know, is every time she goes into a home, she is greeted with the warmest embraces and smiles because people know her in that facility, both the residents and even some staff. The ombudsman work is really to solve problems when they arise and to make sure that the residents are not only being cared for well, but that their quality of life is highlighted, that individual is being championed, and that they know there are people that care about them. And so that's what volunteers do. They are a regular presence in a facility. They are trained by us. We go through a 12-hour training session in the office, 8 visits in the facility, and they go, by the time they are let loose on the facility by themselves, they're comfortable with what their role is. And if they ever have questions, we are always just a phone call away. But training is very, very important because just like anything in life, the more prepared you are, the more confident you're going to be when you enter that arena.
Right. So why don't you inform our viewers then? How do they apply, and what does the application process look like?
Well, the application process is very simple. They contact our office, and we have a web page for the Dayton Ombudsman. We also have a regular phone number that hopefully we can get up on the screen that they can call in to ask to be a volunteer. The one thing I will tell you is that because we are in long-term care facilities, we have to carefully screen and make sure an individual doesn't work for a nursing home, at least for the last 2 years, because many times we are going at it over issues with folks in the facilities, and we need to make sure that people know we are advocating for the resident. So we can't have even the slightest hint of bias or impropriety in favor of the nursing home. So that's really the biggest screen that we do, is this, quote, conflict check to make sure that no one is currently working for a nursing home or a long-term care facility. But if someone is interested, they only need to contact our office. We have a great new volunteer coordinator. Her name's Megan Euler, and she will ultimately train these volunteers, stay in contact with them, and support them throughout their tenure as long-term care volunteer ombudsman. And a volunteer is never alone. There is always a great support system behind them. But when they're out in the facilities, there's really nothing that is more rewarding than the work that you can do as a volunteer ombudsman. I would so strongly encourage anyone who is looking for an opportunity to volunteer where they can really make a difference in someone's life. This is the perfect opportunity for that.
Right, it certainly is. And after the training and after the initial visits, which volunteers, as you said, are accompanied by a more experienced volunteer or by one of our staff or our volunteer coordinator, there are also 6 units of continuing education that are offered each year so that volunteers can get to know one another as a group and can even request that we provide training on certain topics that volunteers might find challenging. So we can respond to that and do that as well.
Isn't that terrible? We ask you to volunteer your time, and then we want you to go to school for 6 hours a year. But we provide all of the training, and they are very relevant topics. And I will tell you that most people that go through the continuing education courses throughout the year are grateful for them, because they're not only interesting and relevant, they help you in your day-to-day work as a volunteer ombudsman.
Well, I think it might be a good opportunity now to tell the viewers maybe some case examples of the type of work that ombudsmen do and the meaning that it can bring and improvement in the quality of life of the residents. Because this could, your examples could either be, conducted by ombudsmen or by volunteers. Either way, yeah.
Certainly. Well, I will tell you that there are as many different types of cases that we deal with as there are thoughts that really run through your head, because just about anything that can happen does happen in a long-term care facility, because we're dealing with people. And again, there is nothing too big or too small for ombudsmen to intervene in a nursing home or assisted living facility. I will tell you that one of the first cases that I was involved in involved a patient who was very concerned because the physician that was providing care and treatment was doing it in kind of an odd way. And what happened was, in this particular case, the resident of the nursing home went to see her doctor in the room that was designated for doctor visits, and he wasn't there. And so she was disappointed, or he was disappointed, and went back to their room, and then later decided that they were going to go look for the doctor again. And lo and behold, they found the doctor at the nurse's station and said, "Doctor, where were you? I was looking for you today." And the doctor then began to do almost an examination there at the nurse's station, discussed medications that this person was taking, all in the vicinity of other residents, other staff that may not have known about this individual's medication list, and it made this resident very uncomfortable. And so we were contacted by the resident, and ultimately we had to sit down with the director of nursing, the administrator, and the physician to make certain that any and all patient care took place behind closed doors. Because there we go back to those resident rights. A resident has a right to privacy, and this right was not being upheld. And so we made certain that the doctor was aware of this, that the staff knew about this, so that if they ever saw anything like this, they could step in and intervene. And sure enough, the patient has never, or the resident has never had to deal with that again. All discussions of their health has been conducted behind closed doors.
Yeah, that privacy is a very large issue and a very important issue to most people, with their health care. Do you have another example for us?
Well, right along the line of privacy, there was a call that we received at our office from in this case, a family member of a resident, and we learned that the resident, who was in early stages of dementia, was going about their daily life in their room. However, the door was always remaining open, and we later discovered that the staff liked to keep the door open because it was easier for them, as they went up and down the hallway, to look in and monitor patients. However, the patient or resident would sometimes begin changing clothes, and the door would remain open. So when we got involved, we had a training with the staff that they needed to keep the doors closed, particularly during peak times when individuals are changing clothes, because not only is the privacy being infringed upon of that resident, but also their dignity. And they may not realize or appreciate that people are walking in the hallway. They may think they're back in their bedroom and they're just changing clothes. But ultimately, the doors to that room are closed during the time when this individual is changing clothes, all because a family member thought to call our office, and we were able to make that change for them.
Right. Very good. Another very good example of advocacy and intervention. Let's hear another.
Okay. Well, I could go on and on with stories. I will tell you that there are times that we are called in cases where individuals are at home and they are receiving care at home, and that is relatively new in the long-term care ombudsman world. But I would tell the audience that our services as long-term care ombudsman extend to individuals receiving home health care. It is a growing area of practice. Unfortunately, most agencies that are providing home health care don't tell their patients that if they have a problem with the service they're providing, here's the ombudsman's number, you can call them. Well, one gentleman actually was aware of the ombudsman's office and called us. He was an individual that each day went to work, but he needed assistance in the mornings getting up because he could not get himself or herself out of bed. So it was so important that the home health care agency be there early enough to help him out of bed. And sometimes when she would try and get out of bed, if no one was there, they weren't going to work because they'd end up falling on the floor. So they called our office and said that they had gone for several days, 3, without someone responding at the home health care agency. Could we please help? Well, we did, and immediately got a hold of that agency and explained why their work was needed, and that quite simply there were too many home health care agencies out there that are very, very skilled and diligent. And in fact, we were able to help this individual make a decision to switch agencies, and then kind of keep track for a couple of months to make sure that everyone was showing up on time, and they did. And after about 10 weeks, we were able to close our case because every morning the home health care agency, the new one, had showed up, and thankfully this individual has not had to miss any other days of work because of a aide not showing up.
Not appearing, yes, exactly. And again, that supports the independence and the dignity and the quality of life of that individual. I'd like us to get out our website and our telephone number, both for individuals who may need our services or want to request our services, and then also for any individuals who might be interested in volunteering with our program. So we'll do that now and then get it up, hopefully. Our website is www.dayton-ombudsman.org, and Ombudsman is right here on the screen beside us, so you can see how it's spelled there. And our telephone number is 223 4613. Just wanted to also add that we have a fantastic core of experienced volunteers that are interested not only in being volunteer ombudsmen, but in assisting new volunteers. Altogether, our volunteers have been with us for an average of 5 years. So I think that speaks volumes to the loyalty to the program and the value to them of the work that they do, just like we've spoken about how it is so very important to the staff.
I would say, Diane, in that as well, we've had some volunteers who have tried to go to other organizations to volunteer only to come back because the work that we do as volunteer ombudsman, the work's so unique and the skills that you develop are unique to this line of volunteer work that they've come back. And of course, we know every organization that utilizes volunteers is important, and people need to try different programs. But the volunteer ombudsman work as advocates is such a unique experience. I cannot emphasize enough how unique and how rewarding it is.
And I would just like to stress the point you made earlier about the training, because we recognize that there isn't anywhere else that a person can go to receive training to be an ombudsman. It has to come from us. You can't take a course online. You can't go anywhere and learn what the ombudsman skills are and what the rights of the residents are and how to advocate for those rights. So we're very pleased to provide that training and enjoy doing that very much. So we are about to run out of time now, so if you have closing remarks, I think it'd be a good time to do it now.
Okay. Well, the work as a long-term care ombudsman is like no other job I've had. In fact, it's a passion. I will tell you that I left and retired from the practice of law because I really wanted to find something where I could help people. And there is no job that I have researched or looked into that really has the ability to affect people's lives on a daily basis for the positive than the work we do as long-term care ombudsman. And the volunteers are the heart and soul of our organization, and they do so much work to make life so much better for folks in the long-term care facilities that I would encourage anyone that is thinking of volunteering to give it a try because the rewards that come from the job as an ombudsman volunteer are like no other that are out there.
Right. Thank you very much. And just the presence of an ombudsman being in the building sometimes makes a difference for residents and for staff there, to know that there's a person there whose job it is and whose mission it is to be advocating for the residents and their rights. So. All right, if you're one of those people that is looking for a volunteer opportunity, we've put our number and information up there. If you're a person that is perhaps thinking that you might need to learn how to select an ombudsman program, we're there to help with that as well. If you have a relative in a facility and you have questions about any care or treatment that you might think is a violation of their rights, we're also also there for you. So I guess if there's any problem that you think we could help with, just pick up the phone and call. And if we're not the right entity, we will do our best to get you to the right one. So thank you so much, Chip, for coming on the program tonight. It's good to hear more about our work as long-term care ombudsman. And thanks to the viewers, and thanks in particular to our volunteer ombudsman who called in and shared their thoughts tonight. Good night.